Well, in my previous lecture regarding nucleotide metabolism, I particularly mentioned you about the Solvage pathway. And I mentioned you, I'm quickly revising what I taught you in my previous lecture. What is the Solvage pathway? And to describe Salvage Pathway, I told you that if the dietary small amount which is obtained from the diet of the nucleic acid that is not degraded, that can be converted to still that can be converted to nucleoside triphosphates, which are used by the body, and this is referred to as Salvage Pathway. And in connection with the Solvage Pathway, I particularly talked with you very important topic of the Leach-Nyhan syndrome. And while talking this syndrome, Leach-Nyhan syndrome, I told you that it is an X-linked disorder, and it is associated with the deficiency of the enzyme that is HGPRT. You have seen, I've shown you that in the diagram, that also that HGPRT. And when there will be deficiency of this enzyme, that results the inability to salvage hypoxanthine or guanine. And when these will be not salvaged, the hypoxanthine and guanine, and excessive amount of them, uric acid is produced. So this was, generally I was talking about that, and I was discussing this, I also discussed in the disorders which are related with Leach-Nyhan syndrome, and in that I talked with you the motor dysfunctions, cognitive defects, and the behavioral, how the patient behaves, the disturbance that includes self-mutilation and lips and tongues biting, and I showed you diagrammatically also. Today, after going that small discussion, what I taught you in my previous lecture, I'm going to talk you the degradation of the purine nucleotides. And if you look this diagrammatic presentation, I've taken this from the book of the Lippincott. It is given there on the page 299. This diagram is there. It is very nicely and clearly mentioning that how the breakdown is taking place. If you look in the diet nucleic acid, DNA, RNA from the mouth taken inside, going, and then when it enters in the stomach and there is low pH, then denaturation of, in low pH, the denaturation of DNA or RNA is taking place. And this denatured, now nucleic acid, when they proceed further in the small intestine, particularly is mentioned here, the small intestine, these nucleic acid then they come across the pancreatic enzymes. With these arrows are telling you the pancreatic enzymes, and what happened? These pancreatic enzymes then further break down these denatured nucleic acid, which you have taken right from the diet, into oligonucleotides. And the oligonucleotides then further processed, this is all happening in the small intestine, into mononucleotides. And here then the mononucleotides, then they are converted into the nucleosides. It is here I'm pointing it out, it will be converted into the nucleoside. This is all happening in the small intestine, and then further proceeding, and there the purine and pyrimidine formation, and these, when go into the intestinal mucosal cell, passing on, it is mentioned here. On one hand, go into the circulation, and on the other hand, they are then converted into the uric acid, and this uric acid form is then excreted in the urine. This is concern now today, that how the uric acid formation taking place, how there is the breakdown from the of the nucleic acid from the diet we are taking in, and very clearly it is mentioning, and very nicely this diagram is indicating that the DNA or RNA, then while competing with the low pH, their denaturation take place, then denatured nucleic acid formed. These denatured nucleic acid, when they come across with the pancreatic enzymes, that is the nuclease, and that is converted into oligo. Oligo, you know what is meaning of oligo? Two or more compounds are known as the oligo disaccharides. When more than two or more than two, they are oligo. And this oligo then is further broken down into the mononucleotides, and the mononucleotides then into the nucleosides, and these nucleosides then in further processing, deoxyribose and purine pyrimidine going into circulation, and uric acid formation taking place. Now, if this is, I try to divide these steps of the formation of the uric acid. In the next diagram, it is all these steps are mentioned. 5 steps here are mentioning, and which tell how the formation of uric acid is taking place. If you see number 1 here, the formation, that the diagrammatic representation I've showed you, and now how actually these reactions taking place, that is we are going to discuss. You see in the number 1 place, that is the amino group is removed from AMP to produce IMP, and then there is an enzyme, that is adenosine on hypoxanthine ribose by adenosine ribodeaminase, that is used. The first step is there. Then IMP when formed and GMP, they are converted. First the IMP is formed, then IMP and GMP, they are converted to their nucleosides forms. And you know what are those nucleoside forms? That is the inosine and guanosine. Now, once they are formed, in step 3, the inosine and guanosine, they in their respective purine bases, they are there, formation taking place, and guanosine is denatured to form xanthine, step number 4. And step number 5, hypoxanthine is oxidized by an enzyme and to xanthine. You know that this is the basic line of where we will be proceeding further, which is now xanthine, which is further oxidized to it is further oxidized by an enzyme. And what is the name of that enzyme? That is the xanthine oxidase. Xanthine, our main goal is to get the formation of xanthine. The xanthine is then in the presence of an enzyme, xanthine oxidase, it is converted to the uric acid. The final product, this uric acid is the final product of the human purine degradation. And this uric acid, you know, then is primarily excreted in the urine. Talking to you the 5 steps In my previous slide, I showed you there are 5 steps for the formation of the uric acid, and now these 5 steps very clearly it is mentioning here. It is being mentioned here in the book, and this is on the page 300. Page, note it down. On page 300, you see, when the lecture is being delivered and the teacher is telling you the book also, in your case, second year case, the book of Lippincott is exactly according to the University of Health Sciences requirement for the examination. And wherever we need further detail, we maximally try to utilize another book of biochemistry, and that is the Harper, Biochemistry by the Harper. So these 2 books are mainly covering your all syllabus. So that's why whenever the lecture is going on, whosoever teacher, me or my or any other departmental teacher is taking class, better open the book, better you open your book and see, go on watching your that book page and then see what is the teacher is telling you, because that will help you to understand. Now, coming back to the point I was talking, I told you about the 5 points that how the uric acid is formation is taking place, and now that is being indicated diagrammatically. Reactions are being mentioned here, and if you see exactly, you see exactly the 5. I mentioned 5 points. My marker is telling number 1, reaction 2, reaction 3, reaction 4, and then reaction 5. This is regarding one side, and on the other, the guanine, because this was I was talking of the inosine. The inosine formation, deamination of the taking place here, and the pointer is adenosine, and that is deaminated and then converted into inosine. This inosine, in the presence of the enzyme, is converted into hypoxanthine, and hypoxanthine into the xanthine, what I told you, and xanthine is then converted into the uric acid. This was particular about the adenosine. Now coming to the guanine here, this reaction is very clearly mentioning that guanine, and from where the guanine is formed, it is the GNP. I told you in the beginning, it is the GNP. Here, it is not taking, this is reaction number 2. In reaction number 3, there is the formation of the that is guanosine, and then the guanine, and this guanine is then deaminated and forming the xanthine. Now, this xanthine is the basic requirement for the formation of the uric acid. This is diagrammatic representation, and this is telling, this diagram is telling how this reaction is taking place in the book. Sometimes there is university question that write down the steps for the formation of the uric acid, so you have to remember these steps also. Now, I will be definitely talking the disorders of uric acid formation. As I talked about you, the Leishman syndrome, very important that here in previous, here today is the gout I'm going to discuss. The gout is the disorder which is characterized by hyperuricemia. Now it is all mentioned here. It is by high level of the uric acid, the gout. When you will go to your clinical side, you will come across the patients not aware with the medical terminology, and may come to you कि जी गैंठिया हो गया मरीज को, कि जी हमें गैंठिया की तकलीफ हो गई है. अक्सर आपके पास आएंगे, लेमैन हैं, आके कहेंगे हमें गैंठिया हो गया. तो बेसिकली वो गाउट की फॉर्म्स हैं जो कि वो उनको तो नहीं इल्म है, लेकिन नाउ you being a doctor at that time, inshallah, you will be in position to differentiate that what type of the gout is there. And this gout, which is present there, it is due to hyperuricemia. There is hyperuricemia. Now, what is hyper? You know, hyper, more, what? More than level with the hyperuricemia as a result of the hyperuricemia may be due to overproduction or underproduction of the uric acid. So keep it in your mind. This is either the hyperuricemia, which is one, while talking gout, hyperuricemia is definitely into mind, and it is in the blood. And this is hyperuricemia. Two reasons of it. It may be hyper productive activity or under excretion of the uric acid that will be created. Now, I have divided this gout into 5 steps and differently discussed it. That, as I told you, it is the hyperuricemia, and hyperuricemia, what will happen? The hyperuricemia is there, then what will happen? This will lead to deposition of the crystals. There will be formation of crystals, and those crystals are of a monosodium urate. Monosodium urate MSU. Due to hyperuricemia, there are chances and there will be formation of the crystals, that is monourate, sodium monourate crystals, and these crystals, and this while I was in your first year telling you about the carbohydrate in the practical, you prepared the slides of crystals of crisscross shape of the crystal formation. I'm taking you back to your first year class, and there was, you saw under microscope the formation, different shapes of the crystals which were used to differentiate between different type of the glucose, monosaccharide, disaccharide, or polysaccharide. I mean, what is there? And in that crisscross shaped crystal you was watching, similarly of same type crystal formation possible, and these are known as the monosodium urate crystal, and these are formed in joints. There will be formation in the joints. And what will happen due to these crystals? Then there will be inflammation will be there. That will creating inflammation. What is inflammation? सोजन सूज जाएंगे जॉइंट्स, जो है जब इनके अंदर ये क्रिस्टल फॉर्मेशन बनेगी तो जॉइंट्स में सोजन हो जाएगी, ये सूज जाएंगे. And then inflammation, then joint swelling causing the acute, and then the progressing the chronic gouty arthritis. You will call it then the gouty arthritis. Here it is the gouty arthritis. So very interesting that the patient coming to you telling you that pain in the joints. So definitely will come to your mind seeing the swelling there on the joint and his pain. It's very, very severe pain. I tell you one thing, in the case of the gout, patient with very severe pain, cannot walk and sometimes crying, feeling pain. And then you will watch and see, and definitely you will go to find out the reason of their uric acid increased overproduction or unexcretion. Two things you will see. Either the uric acid is overproduced, and there is the reasons of that overproduction, disorders, or it is unexcreted due to certain diseases that will be leading to the accumulation and formation of these crystals in the joints. Then, not only in the joints, in soft tissue also. I'm talking of the point number 3 now here. In this soft tissue, I'm talking number 3, that nucleotide masses of these crystals, they are known the toffee, may be deposited in the soft tissue. In the first case, I'm talking of the joints, and now I'm telling you there is the masses of these monosodium urate crystals. You can call them here now toffee, that may be deposited in the soft tissue. This is in the soft tissues, resulting into the chronic, that is also sort of gout, and that is the chronic toffee gout. Firstly, in the joints, formation of crystals, monosodium urate crystals in the joints, causing swelling, pain, so on, and you will call it the gouty arthritis. Second, in the muscles, in the soft tissues, I'm talking, and there is also chances of the formation of the MSU crystals, monosodium urate crystal, and why these are formed? Because of the either overproduction of the uric acid or under-excretion of the uric acid. Now, there is another chance in the case of hyperuricemia, that is the formation of the uric acid stones in the kidney. Now, interesting. Joints, soft tissue, and now kidney. And when it is in the kidney, it is known as the urolithiasis. That may be seen. I might have examined, come across in your family, people talking of the stone formation in the kidney. Pathri bangi gurde mein, or you know how painful is that. It is also other reasons also, but one main reason is the formation of this, the high level of the uric acid stone is different. And hyperuricemia, it is not necessarily the cause of causing gout, but gout is also produced by the hyperuricemia. Hyperuricemia is asymmetric, but maybe in the active of the conditions such as the hypertension and so on, like that. There are many, as I told you, there are other those. Then, how to find out that there is to detect? Definitely, one thing is we go to the laboratory investigation, and in the laboratory investigation you will refer to the lab for his uric acid level. And second is the aspiration of examination of the synovial fluid from an affected joint. And from there we'll see that if that is present, then we will see under microscope the formation of the crystal you will come across. Now, as I was talking to you, that uric acid formation I told you, and where it is going to form stones in the joints, and gout is there, and in the tissues also, and there is formation of stone in the kidney also. But I was talking to you too, very important point, that the reason is the unexcreted of uric acid, or under-excretion of the uric acid, or overproduction of the uric acid. So little knowledge, let me share with you here, that 90% of the individuals, hyperuricemia is caused by the under-excretion of the uric acid, 90%. And You know it is primarily defect is due to unidentified and inheritance defect, maybe in some cases, and in other conditions, for example, there are problems in lactic acidosis. Lactate increases renal urate reabsorption. Clearly mentioning here. In lactic acidosis, lactate, what is happening? Lactate is increasing renal urate reabsorption, thereby decreasing its excretion. Very, very interesting point here I mentioned you. That's why I'm showing you this slide. That the reason in lactic acidosis, lactate will increase the renal reabsorption, urate reabsorption, and when that will be reabsorbed, decreasing the excretion, and to that is to environmental factors such as use of drugs may be reason of that or other thing. Certain drugs are used, that is thiazide, diuretics. Diuretics, those drugs which produce more urine than the drugs which are given there. Whereas overproduction of the uric acid, a less common cause is from the overproduction of the uric acid. That is the idiopathic and no knowledge cause. However, several mutations in the genes for X-linked PRPP synthetase results in the enzyme having an increased maximum velocity. This and then coming the enzymatic, and this is in the case of the genetically formed condition. Now the next I would like to tell you, when the patient is the person with all these disorders is with you, definitely diet is also factor which is giving rise to the uric acid level, and what type of diet you will suggest to keep the uric acid level normal. Xanthine formation exceeding, and xanthine is then produced into, that is converted into uric acid. So we will suggest, and you will suggest, a diet rich in meat definitely is not good, and seafood, particularly shellfish, and ethanol is associated with increased risk of the gout. हम सजेस्ट करते हैं ऐसे मरीजों को कि वो ख़ास तौर पे जो रेड मीट है, जो जिस गोश्त को हम कहते हैं कि गाय का या भैंस का गोश्त है, रेड मीट है, उसको, और इसी तरह से गोट मीट, तो इसको कम इस्तेमाल करें. और इस तरह से जो ऐसे लोग हैं जो कि ड्रिंक करते हैं एथेनॉल, दैट इज एसोसिएटेड विद इंक्रीज रिस्क ऑफ द गाउट. क्या होगा? चांस होगा इनके जॉइंट्स में क्रिस्टल बन जाएंगे, मोनोसोडियम यूरेट क्रिस्टल बन जाएंगे, उनके किडनी में भी क्रिस्टल बनने के चांसेस हैं, उनके सॉफ्ट टिश्यू में भी ये क्रिस्टल बनने का, फिर वो दर्द ही होगी और फिर हाय हाय करते आपके पास आएंगे. Whereas a diet rich in low-fat dietary products is associated with the decreased risk. Well, this is a point which is still controversial, but anyhow, we suggest that patient should not take such type of diet which may cause the level increased of the uric acid. Now, these are certain diagrams given in the book also indicating you that the gout condition, Proficus gout, it is there. I should have mentioned it on the top here, but anyhow, this is given in your book, and you can see you see the finger particularly indicating this condition here, and it is also very painful for the patient. In the next, this is the diagram is very clearly indicating the joint to differentiate what we go for the investigation. One, I told you we go refer the case to the lab for the uric acid level, but we have to see what type of crystals and things are there. For that, we will go for aspiration. We will take fluid from the joint, from a long needle using syringe. This orthopedic surgeon or the pathology lab or trained person, they take the fluid and they examine under the microscope and they find the monourate crystals, type, shape, and here is those crystals I was talking to you, that in case of glucose and fructose, we was differentiating, examining those crystals here. These are the monourate crystals, what I was talking to you previously. Now, what about the problem is there, everything is there now, the treatment. One thing is that we advise the diet, what type of diet should be taken. Now, definitely, when pain is there, first thing is to reduce that pain, and for that we advise the anti-inflammatory agents. ऐसी अद्वियात जो सोजन को कम करती हैं, the anti-inflammatory agents. Then the life-saving drug, sometimes steroid drugs are also suggested, collagen such as prednisolone. This is a steroid drug, prednisolone. And non-steroid drugs such as idomethacin, and they are used to reduce inflammation. Now, this collagen prevents formation of the microtubules. ये इसका effect क्या है उस medicine का, decreasing the movement of the neutrophils to the affected area. ये जो drug है, anti-inflammatory drug है, it has got directly no effect on the uric acid level. And but the long-term therapeutic strategy for gout involved lowering the uric acid level below its saturation point, that is 6.5, thereby preventing the deposition of uric crystal. देखें जी, point now is clear. It has this drug I'm talking, it has no effect on uric acid level directly. But what this action is, by preventing the deposition of urate crystal, it prevents the crystal deposition. And when the crystal will be not deposited, definitely that will be not irritating that particular area. Then is the uric agents, increasing the production of the urine, more urine is produced, sulfapyramidazole that increases renal excretion of the uric acid, are used in patients who are under excretors of the uric acid. Allopurinol, a structural analog of the, sometime in university question they ask what is the function of the allopurinol, and it is made some not in the SCQ, MCQ also is there regarding this. And you already know what I mentioned here in number 5, that the enzyme and the HDRPT level may be controlled so that there is no formation or less formation of the crystal, and the uric acid level remain to the normal sides.